Hi, I'm Professor Fit RN. In this short, I am going to get a tad bit more thorough on helping you to write a nursing diagnose because it is something that students can often struggle with for semesters. So let's get right to it. In this short, I am going to provide two examples of thorough explaining of how to write a nursing diagnose. The first example is a patient is admitted to the hospital with asthma. So if you are completing this and you're in clinicals, in order to write an accurate nursing diagnosis, you have to first understand the background, the pathophysiology of what asthma is and what is occurring during an asthma attack. So when you look through your nursing diagnose book, sometimes they have certain conditions listed in the back, such as asthma, and it may have a whole list of nursing diagnoses for you to already choose from. So let's say we found ineffective airway clearance. Now, ineffective airway clearance is what you would write first. Next comes the related to part. The related to part is always going to refer back to the nursing diagnose, but it's more so can be related to the pathophysiology of the disease that you're talking about. Now, sometimes you're not always talking about a disease, but we are in this case, well, at least a disorder. We are in this case. So you have to think about what's happening with asthma. Why does asthma cause ineffective airway clearance in the patient? So if you remember, let's go with mucus production. So ineffective airway clearance related to mucus production as evidenced by comes next. Now, the as evidenced by is what you see or what the patient has told you. As evidenced by is not related to the related part. It's actually related to the nursing diagnose. What evidence do you have that this nursing diagnose is occurring in the patient? We say that the patient has ineffective airway clearance. So what's the evidence? The evidence would be, what are we thinking? Ineffective airway clearance related to mucus production as evidenced by how about adventitious breath sounds auscultated. And if you've never heard of adventitious breath sounds, that just means that the breath sounds are not clear. You may also go with the evidence that the patient is ineffective at clearing their airway, audible wheezing. Sometimes an asthma attack can be so bad you don't need your stethoscope. So it's audible. Ineffective airway clearance related to mucus production because the mucus production is causing the patient to ineffectively clear their airway. And the evidence that we have is that we audibly, with our ears, hear wheezing. That is the first example. The next example, let's say you have a patient in clinicals who has experienced multiple tragedies. Again, if you look in the back of your NANDA book, it should have a list of disorders, and I believe maybe underneath depression, we can find risk for impaired resilience. We are going to go with that nursing diagnosis for this because the patient has had multiple tragedies. They've experienced this. So they are at risk for impaired resilience. To accurately write out this diagnose, you have to make sure that you understand resilience. And we know that resilience is that bounce back from difficult situations. It could be difficult family situations. It could be stressors in your life, job loss. It could be illness. It could be trauma, tragedies. This is what resilience is. So next we need to determine what the related to part is. Risk for impaired resilience. Related to what? Well, we just said it. I just gave you a list of things related to multiple tragedies. Now, as evidenced by, what evidence do you have that makes you think that the patient is at risk for impaired resilience? So this information would come from you communicating with your patient to learn a tad bit more about them. Maybe they've told you that they don't have any strong relationships. So, as evidenced by lack of support system, would be what you would write. Or maybe it's because they don't have any coping skills. And that is something that you can use a lot when you're writing psych diagnoses, because patients sometimes don't have coping skills. They may have them, but they won't do them, or they don't like them. So, risk for impaired resilience related to multiple tragedies as evidenced by lack of support system, or as evidenced by patient verbalized has no coping skills.